Hello, viewers. Good morning, and welcome to today's episode on Health Corner. We'll be taking a look at cancer, its causes, symptoms, and prevention. Cancer has become a global phenomenon due to its high mortality rate in recent times. Come with us as we unravel this issue, seeking better ways of reducing to minimal its high mortality rate in Nigeria and the world at large. I am Promise of Fame.
Cancer is a public health problem worldwide affecting all ages. It is the second commonest leading cause of death in developed countries and among the three leading causes of death in developing countries. World Health Organization reported that about 24.6 million people live with cancer worldwide. In Nigeria, cancer leads to over 72,000 deaths per annum, 30,924 for males and 40,647 for females. This number increased greatly in 2021 as approximately 14 million new cases were recorded. Breast cancer is now leading in cancer death rates in Nigeria. It should be noted that both men and women could develop breast cancer. Liver cancer is the second, and prostate cancer is the third. Incidence of cancer has been increasing in most regions of the world, but there are huge inequalities between developed and developing countries like Nigeria. Incidence rate remains highest in more developed regions, but mortality rate is relatively much higher in less developed countries, due to relatively low cancer awareness, late diagnosis, and access to treatment facilities. Over 70% of the cancer patients present late stages 3 and 4, with few patients having access to the limited treatment facilities. More people are diagnosed of cancer at advanced stages because so many people in Nigeria believe that cancer is white people's disease, while some strongly believe that cancer is usually sent to other people by magical power known as juju or a demonic attack, and others believe that it is a punishment sent to humanity from the supreme being. Consequently, some persons diagnosed with cancer in this part of the world would visit traditional healers and faith-based centers where they believe that they can be cured. Some of them get incision on the affected part, brainwashed never to accept that they are battling with cancer. Rather, they should rebuke and employ the "not my portion" exclamation. And after the series of visits to different traditional healers, they eventually reverse to the healthcare facility at a very advanced stage where only palliative care can be offered. Hence, the reason for the high mortality rate in Nigeria and other developing countries. Cancer can affect any part of the body, as we have cancer of the eye, nose, mouth, lungs, liver, skin, breast, cervix, etc. Come with us for an interview session with Dr. Omaren as he further explains this issue of great concern. Please stay with us. I am Emediong Efiok.
All right, good afternoon. My name is Dr. Godwin Omaren. I'm a medical practitioner, of course, working with the Akwa Ibom State University Medical Center. I'm the senior medical officer here and actually the head of department. All right, today we want to have a kind of health talk on something that is very common, and we want to bring to fore and educate some people about what we call cancer. By way of introduction, we know that the body, our body system, we have cells, and cells in the body divide. That is what we call division of cells. When those cells divide during growth, you can bear me witness, the way you are now, 10 years ago, you were not like this, meaning you are growing. So the growth that takes place is possible because of cell division. So as cells is dividing, there is growth and development. Also, there is cell division when in a healing process. Maybe you can have a cut. After 1 week, the cut is being healed. That means there is a division of cell. That means there can be some destruction of the harmful cells or the dead cells, and also there will be remodeling of new cells. All right. So this normal cell division lead to growth, lead to development, lead to healing processes, and lead to repair of worn out tissues. But there are some instances that cells will divide abnormally. When once there is abnormal division of cells, that is what will lead to some abnormal growth in the body, which are termed as tumors. So now tumor now is abnormal division of cells in the body. That is tumor. Which in this tumor, which some can call cancer. But we are going to break down and know what really is this cancer. Remember, tumors are abnormal division of cells in the body, which can be triggered by some other factors. Of course, we are going to look at factors that can make cells to divide abnormally. Fine. But what you need to know now is that when one cells divide abnormally, there will be abnormal growth, uneven growth, which you have a swelling. Maybe externally you see the swelling, internally you don't see, it's still a swelling, a mass. Such a mass is known as a tumor. Fine. Tumors are divided into two. We have the benign tumors and we have the malignant tumors. What we call the benign tumors, the friendly tumors, are tumors that their abnormal division is within the framework of where they are, and they will stop the division after some few hours or days. That is benign tumor. Benign tumor doesn't affect the surrounding tissues. That is benign tumor. Remember, two types of tumor. The malignant tumor will continue to divide. These malignant tumors are known as cancers. So cancer now is an abnormal division of cells in the body which spread to other tissues. It affects the cells of the surrounding. It can even lead to the death of other cells in the body. It can spread to other organs. Such tumors are known as cancers. Now, we have types of cancers. Three types of cancer. The first type is known as carcinomas. I will explain. The second type is known as sarcomas. The third type is known as the lymphomas or the leukemias. Carcinoma is cancer that affects the lining of tissues or the skin lining. So any cancer on the skin lining is a carcinoma. Lining of organs like what? The prostate, breasts, lungs, all those are organs. So cancer that affect those lining are the surfaces. The external surface is what we call the skin. The same way you have the surface of your gullet or your trachea. There are surfaces. So lining of those surfaces, when once those surfaces divide abnormally, cancers that affect those surfaces are known as carcinomas. We enter the second one, sarcomas. Sarcomas are cancers that affect connective tissues. What do we call connective tissues? Like bones, muscles, all those ones are connective tissues. So cancer of the bone is a sarcoma. We have the third one, the leukemias or the lymphomas. That is cancer of the blood. Cancer of the blood is known as leukemia. At least that one is common. Leukemia is cancer that affect the blood. Lymphomas, cancer that affect the white blood cells. We have different blood cells. The white blood cells, lymphomas, we have the leukemias, cancer of the blood. All right. So those are basically the three types of cancers that we have. All right. Let's look at how can I know that this growth is cancer. We go to diagnosis. What we call diagnosis. Diagnosis is the what and what to do to know this particular challenge or symptom or pathology. Diagnosis of cancers. Of course, we start from what we call the imaging techniques. Like now, you can see me. What makes it possible for you to see me, or for this to be recorded, or for it to be filmed? That is imaging. Imaging technique. In medicine, we have imaging techniques, which in other cinematography, they have cameras, they have videos. In medicine, we have imaging technique. One of it is X-ray. X-ray is an imaging technique which they use some high beam rays to focus on some organs to detect the pathology of those organs. Pathology is sickness, disease of such organs. So diagnosis of cancer, we can use X-ray techniques. We can use a CT scan, that is still imaging technique. We can use MRI, that is another imaging technique. Magnetic resonance imaging technique. We can use those ones. Now, those imaging technique can now detect the size of the cancer, the shape of the cancer, and the location of the cancer. Now, another diagnosis we can do a blood test. They take your blood sample. That one can now make us to know the nature of the cancer, especially the blood cancers. For instance, somebody start having bone pains, which is part of the symptoms of leukemia. What did I say is leukemia again? Cancer of the blood. Somebody have bone pains. You want to know what really is the problem. You can take a blood sample and check under the microscope and know, definitely this person may have a blood cancer. We can also do what we call the biopsy of tissues. Biopsy means you pick the tissue of that growth. For instance, somebody have a breast cancer or a breast lump or tumor. Remember, I started with tumor. Tumor is any abnormal growth, and you don't know whether it is cancer or not. Remember, I said tumor can be benign, the one that is not bad, can be malignant, the one that we call cancer. And somebody come to you and have a growth or a mass, a strong mass or a lump in the breast. You want to know, this lump, is it just ordinary lump? What you do is you take a biopsy of that tissue. There is a biopsy needle. You put a needle to that place and it picks the tissue. They now take that tissue to the lab, histology lab, and check. From there, they will know, really, this is a cancer or this is a tumor, and a normal tumor of the body. So those are the diagnoses. There are other ones, but basically we have those three ways that we diagnose cancer. Right. Having looking at the diagnosis, let's also look at treatments before we come down to prevention. Treatments. Some people say that cancer doesn't have a cure. Is that really true? Treatments. All right. How can we treat cancer? When once you go to the hospital and they diagnose it, they now know definitely this is a cancer. What is the way forward? Oncologists make us to know that early diagnosis is very good in treatment. Who are the oncologists? Oncologists are medical doctors that specializes in the treatment and diagnosis of cancers or tumors. They are known as oncologists. So that is why anybody that have a tumor or a cancer, I, as a general practitioner, I will not treat you. I will now refer you to who? Oncologist, a doctor that specializes on that. So oncologists make us to know that early diagnosis is very good and have a good prognosis in treatment, as in it will give us a good outcome in the treatment of such cancers. Early diagnosis, that means that if you have any growth on your body, don't wait and begin to take antibiotics and begin to want to go to chemist or take over the counter medication. See a doctor, because that growth in your body can at the end of the day be cancerous, can be a cancer. And if it is diagnosed early, the treatment is very possible. What are the treatment modalities for cancer? We have, of course, 3 treatment modalities also. What are they? We have surgery, that is 1. 2 is chemotherapy. The 3rd one is radiotherapy. I will explain. Surgery, of course, that one is common. Surgery will means cutting into the body to remove that cancerous tissue. That is surgery. So, for instance, surgery of the breasts, that means they will open up, remove that cancer cells from the breast. That is a breast surgery for cancer. So one major treatment modality is by surgery. The second one is chemotherapy. Chemo, the use of drugs. Therapy means what? Treatment, to find a cure to something. So using drugs for treatment of cancer is called chemotherapy. There are some chemo drugs that we use to treat cancers. So you when you go to the hospital, they place you on some medication. Of course, they are taking in cycles. You take for a period of time, go back to check, and you take it again till maybe it is able to inhibit the growth of that cancer. The last one is radiotherapy. Radiotherapy means what? The use of rays, the use of high beam, the use of radiation for the treatment of cancer. The use of radiation. That means that they will focus some high frequency radiations into that tissue, that cells. What that radiation will do is it will shrink the cancer or inhibits the growth of that cancer, whereby the cancer cells will die off. So those are the 3 treatment modalities for cancer. Finally, let us look at the prevention of cancer, because that is the one that is very, very educative. How can I prevent cancer? We have three levels of prevention. We have the primary prevention, secondary prevention, and tertiary prevention. Primary prevention is the one that you don't wait till you have cancer. That is the one that involves all of us. That is the primary prevention. What should I do so that I will not have cancer? Of course, remember when I talked about the etiology, causes of cancer. One of the causes of cancer is that it is familial. It runs in the gene, genetic. It's genetical, meaning that if my father or my grandfather had cancer, surely, or it may, I have the likelihood, the probability of me having cancer. Why? It runs in the family. That is genetics. That means in the point of genetics, you can't do anything. For you coming from that family, it means you may come down with cancer. Fine. So primary prevention is to look at how to stay away from things that causes cancer. Healthy lifestyle, drinking of water, exercising, food that you eat. A lot of us, especially the youth, they like junk food. They don't want to cook. They like fast food. Fast food contains some carcinogens. Carcinogens are things that causes cancer. Carcinogens. And you may see it in fast food, processed food, canned food. Like, I don't want to mention a particular company. Canned fish. You know, they ask how they can a fish and keep. So those food can contain carcinogens. So lifestyle modification, stay away from those food, eat good food, drink water, exercise. That is primary prevention, of course. Secondary prevention is that when you have any growth in your body, like a lump in the breast, like a growth in your body, like a mass in your abdomen, see a doctor so that they diagnose early. Remember what I talk about oncologists. They say early diagnosis can lead to good treatment. Tertiary prevention is, of course, when the cancer is already there, to take care of it, they cut it off, and of course, how to live your life after the cancer cells has been removed. That is actually what we have to know about the cancer. Remember, I made mention of so many types of cancer, which I have grouped them. Does all cancers that we have lead to amputation or cutting off of that tissue or that organs? You know, this is a good question because this is what make people not to go to the hospital, because they are scared. If I go, some just a lump that may not be cancer, they are scared of going to hospital. Remember, I said that oncologists say early diagnosis will give you appropriate treatment. If you are diagnosed early, remember what I talk about cancer, they spread to other organs. So if you are diagnosed early when it is only at one particular place, they can't cut off that breast. Rather, they will remove that tissue. But if you go when it has already spread, it has touched the muscle, it has touched even the bone, they will cut it off. Because if they don't cut it off, it will spread. You will die. Such a person will die. So not all cancers can lead to amputation or cutting off. As far as you have cell, skin, there is cell. When the cells in my skin begin to divide abnormally, I have cancer of the skin. In the eye, if I have division of cells in my eye abnormally, I have cancer of the eye, retinoblastoma. We have a names for them. In the nose, if I have abnormal division of cells in the nose, I have cancer there. In the throat, like smoking, I didn't mention smoking. Cancer of the lung, very common to smokers. Abnormal smoke contains carcinogens that can lead to causation of cancer in the lung. So actually, any organ, any tissue can develop cancers. How long would I live if I'm now told today that I have cancer? You can live 24 hours only. You can live 10 years. You can live till when you are ready to pass on. Why? Yes, that is the answer. Why? Early diagnosis. If I hide my breast cancer for 3 years, then I go when it's already on my neck, has entered my spinal cord, I cannot walk, it has entered my waist. Then I am being diagnosed of breast cancer. Between you and me, we know that you can't live long. You can't live long. But if I present early, maybe a small lump I see in my breast, I present in the hospital. They check it and know that it's cancerous. They remove it. I can live my normal lifespan. So it's understood that lifespan of a cancer patient depends on what? Early diagnosis. cancer preponderance depends on the type of cancer. Like now, the highest prevalence of cancer in females is the breast cancer. Breast cancer affects male females than males. Prostate cancer, of course, prostate is an organ in the male, affect more males than female. So the ratio depends on the kind of cancer. How can you identify a breast tissue that is cancerous? Breast cells, remember, taking you back to cancer. Tumors, I say tumors. Tumors can be the friendly one, can be the malignant one. Fine. So breast cells, breast tissues have normal breast tissues. They are fluffy in nature. Some of us, the ladies, they don't touch their breast. Is a taboo to touch the breast. No, you need to do a monthly breast examination, especially when you are taking your bath. When the soup is all over your body, you start touching it, feeling it, so that you will know the normal breast tissue. Breast tissue is fluffy, it's just soft. If you don't know the normal, you will not know abnormal. So when once you see something that is not the thing that you've been feeling, you will know that this thing is not abnormal. Abnormal breast tissue is strong, like stone. You just touch, oh, this one is soft. But you see this one is very strong, hard. Of course, initially it's painless. So you will not feel any pain. That is why the best way is to examine your breast. It's painless. It is until when you accidentally, as you are touching, you now touch something is strong. That strong, stony mass. So when you go to the hospital, they now check whether it's benign tumor or malignant. If it is malignant, they call it cancer.
Welcome back. Trust you learned a whole lot on cancer, ranging from its possible causes, symptoms, and prevention. With this wealth of knowledge, let's work together to ensure that this issue is tackled adequately. Thanks for staying tuned. Your host, Promise Ofem.